Hello, this is a virtual microscopy slide of invasive lobular carcinoma of the breast. We can see here that this is a core biopsy with several tissue cores. Let's zoom into the normal area first. We can see that there is a duct here that is benign, and we can still make out the bilayered epithelium with the luminal cells and the abluminal cells, or the myoepithelial cells. Here we can see a lobule of breast parenchyma, and these are the acini, which again are lined by bilayered epithelium. Let's now have a look at the abnormal areas, and I'm going to focus on this tissue piece. In this core, we can see that the pink collagenous or fibrous stroma appears to be a little bit more cellular. We can appreciate that there are cells that appear to be arranged in a single file arrangement or in cords. And looking more closely, we can see these single file arrangements of cells with relatively small nuclei. Zooming in, we can appreciate that these cells have quite small nuclei, relatively scant, pale cytoplasm. We can see the pale cytoplasm here. And they are arranged in a single file arrangement. And in some areas, the cells are more dispersed, and there are even single malignant cells in other areas. These can be quite deceptively blend and can be quite difficult to pick up, especially when there are only one or two invasive cells in these areas. A cytokeratin stain would be very useful in order to highlight the presence of these abnormal infiltrative epithelial cells. When we move around, we don't see any obvious tubule or gland formation. Again, over here, we can see all these infiltrating malignant cells directly sitting in the stroma. Also, we don't see a very marked desmoplastic stromal response. The stroma does not appear to be particularly cellular with fibroblastic proliferation or inflammatory cells. And this is quite typical of lobular carcinoma. It does not tend to incite a strong desmoplastic response. Also, for this reason, this tumor can be quite difficult to identify grossly because it doesn't form a very definite, obvious mass. Here is another feature that is quite characteristic in lobular carcinoma. In the center, we have a little compressed benign ductal structure, and the malignant cells sometimes tend to arrange themselves in a concentric manner around a benign ductal structure. It kind of resembles the look of a multi-layered onion skin. This is not the best example, but we can see that there is an attempt at surrounding this normal benign duct. Let's learn a bit more about lobular carcinoma. Invasive lobular carcinoma makes up approximately 10% of invasive breast carcinomas. It tends to occur at an older age compared to the more common invasive carcinoma of no special type, previously known as invasive ductal carcinoma. So it tends to occur later in life, in the range of 60 plus years of age. The risk factors include prolonged estrogen exposure, for example, early menarche and late menopause, and also the administration of exogenous hormones, for example, oral contraceptives or hormone replacement therapy, lower parity, alcohol consumption, as well as obesity, which are related to estrogen levels. Clinically, the diagnosis tends to be later, and this is not surprising because these tumors don't tend to form a very obvious mass. So clinically, there may just be a vague area of thickening, a vague mass, or just induration. This tumor may be bilateral, and it also may be multifocal within the same breast. This means different areas can be involved with normal breast tissue in between. On imaging, the findings can be relatively subtle, especially on mammography, where there may be just a degree of architectural distortion. And on the ultrasound, there may be a speculated mass, or sometimes the mass can be quite ill-defined. Grossly, again, there may not be a very obvious, well-defined mass on inspection. However, when the breast tissue is palpated, usually it will feel somewhat hardened or indurated, and there may be just a discernible, ill-defined mass. On microscopy, as we saw earlier, we have this single file arrangement of malignant cells, and they are very discohesive. These cells tend to lose the membranous E-cadherin expression. So if we do a E-cadherin immunohistochemical marker, it will be lost or negative. And the cells are very small with eccentric nuclei and scant cytoplasm. This picture is taken from Pathweb, which is our free online pathology resource. And here we have a virtual pathology museum with more than 1,000 fully interactive virtual pathology specimens, and all annotated and labeled. We also have lots of labeled microscopic pictures and also interactive quizzes. Registration is completely free, and you can find the link in this video description. Sometimes in lobular carcinoma, we can also see intracytoplasmic lumina, such as this, within individual cells. And these are cells of invasive lobular carcinoma metastatic to a body fluid sample. This is a cytology smear, and this is a Papaniculae stained smear. And this picture is just to recap the concentric arrangement of malignant cells around benign ducts. Hence, in summary, this is an example of invasive lobular carcinoma of the breast, and we can see that the cells are arranged in these single file arrangements, or just as single cells infiltrating into the stroma. The cells are small with eccentric nuclei and scant cytoplasm, and they do not incite a desmoplastic response. This leads to this tumor being relatively ill-defined grossly, and therefore sometimes it is diagnosed quite late. And once again, I would like to invite you to check out Pathweb, our free online pathology resource. Here is an example of a virtual pathology specimen, which is fully labeled and interactive. It can be rotated and magnified, and this is available for free in Pathweb. Thank you.